Hello there. Thanks for tuning into the Highmark Health Options Health Awareness Series. We're glad you're here. Today we are going to talk about diabetes. What is it? What are the types of diabetes? What is an A1C test? And what does Highmark Health Options cover? This is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your doctor or other qualified health provider with any questions or concerns about your health. Before we jump in, let me share some statistics about diabetes both in the United States and in Delaware. Diabetes in the United States. As of 2019, 37.3 million Americans had diabetes. Of that number, 1.9 million Americans have type 1 diabetes, which includes 244,000 children and adolescents. Of the 37.3 million adults with diabetes, 8.5 million of them are undiagnosed. 1.4 million Americans are diagnosed with diabetes every year. In 2019, 96 million Americans age 18 and older had prediabetes. Prediabetes is when you have blood glucose or blood sugar levels that are higher than normal, but not yet high enough to be diagnosed as diabetes. You may have some of the symptoms of diabetes or even some of the complications. Let's talk diabetes in Delaware. Approximately 96,844 people have diagnosed diabetes. About 24,000 people have diabetes but don't know it, greatly increasing their health risk. More than 35% of the adult population has prediabetes, which again means blood glucose or blood sugar levels are higher than normal, but not yet high enough to be diagnosed as diabetes. Every year, more than 6,000 people in Delaware are diagnosed with diabetes. Here are the topics we're going to cover. What is diabetes? What is an A1C test? And what does Highmark Health Options cover? Let's get started. What is diabetes? People develop diabetes when the pancreas can't make insulin or the body can't use the insulin that the pancreas produces. The pancreas is an organ located in your abdomen. It plays an essential role in converting the food we eat into the fuel for the body's cells. The pancreas has two main functions. One function that helps in digestion, and one function that regulates blood glucose, also known as blood sugar. What is insulin? Insulin is a hormone made by the pancreas. It acts like a key to let glucose from the food we eat pass from the bloodstream into the cells in the body to produce energy. There are three main types of diabetes: type 1, type 2, and gestational, which occurs during pregnancy. Let's talk about type 1 diabetes. It can develop at any age, but occurs most frequently in children and adolescents. Your body produces very little or no insulin, which means that you need daily insulin injections to help manage your blood glucose levels. Currently, there is no known cause or cure for type 1 diabetes. Type 2 diabetes is more common in adults and accounts for around 90% of all diabetes cases. With type 2 diabetes, your body does not make good use of the insulin that it produces. A large part of type 2 diabetes treatment includes increased physical activity and a healthy diet. Your healthcare provider might also recommend medicine. In gestational diabetes, that consists of high blood glucose during pregnancy and is associated with complications to both the mother and the child. It usually disappears after pregnancy, but mother and child are more likely to develop type 2 diabetes later in life. In addition to type 1, type 2, and gestational diabetes, a small group of people develop specific types of diabetes due to other causes. This includes conditions like cystic fibrosis and pancreatitis, the use of drugs for treating HIV or AIDS, or after an organ transplant. Before you develop type 2 diabetes, you might have prediabetes, where your blood sugar levels are higher than normal but not yet high enough to be diagnosed as diabetes. It is possible that you may have some of the symptoms of diabetes or even some of the complications. If you think you may have diabetes or prediabetes, check with your doctor and get tested. If you have prediabetes, it doesn't mean you'll develop type 2 diabetes. Following your doctor's treatment plan and making changes to your lifestyle through food choices and physical activity will help. Even small changes can have a huge impact on delaying or preventing diabetes altogether. Work with your doctor to make a plan that works for your lifestyle. Let's talk about an A1C test. An A1C test is a blood test that checks your average blood glucose or blood sugar level over the past 2 to 3 months. This test also is called a glycohemoglobin test or a hemoglobin A1C test. The A1C test is one of the tests used to diagnose prediabetes and diabetes. If you have diabetes, this test is done to check how well your diabetes has been managed over time. Your doctor can use this information to adjust your treatment if needed. The A1C test is a critical step in forming your care plan to manage your diabetes with your care team. What do the test results tell you? When it comes to the numbers, there's no one-size-fits-all target. A1C target levels can vary by each person's age and other factors, and your target may be different from someone else's. The goal for most adults with diabetes is an A1C that is less than 7%. A1C test results are reported as a percentage. The higher the percentage, the higher your blood sugar levels over the past 2 to 3 months. The A1C test can also be used for diagnosis based on the following guidelines. If your A1C level is between 5.7 and 6.4%, your levels are in the prediabetes range. If you have an A1C level of 6.5% or higher, your levels are in the diabetes range. What does Highmark Health Options cover? Some diabetes supplies are covered as part of your Highmark Health Options benefits. They include alcohol wipes, CGMs or continuous glucose monitors, insulin pumps, lancets, medications, replacement batteries, shoes or orthotics, syringes and needles. To learn more about your Highmark Health Options benefits, you can review information in the member handbook, visit highmarkhealthoptions.com, or you can call member services at 1-844-325-6251 Monday through Friday from 8 a.m. to 8 p.m. And that brings us to the end of this topic. If you would like to learn more about the Health Awareness Series and watch more episodes, visit hho.fyi/HAS. Thank you for joining us. We'll see you soon.